Good afternoon everyone. Welcome once again to MGM Healthcare's Facebook Live Kids Health Talk, a series of talks from MGM Children's, the Department of Pediatrics and Neonatology at MGM Healthcare Chennai. In this series, we have pediatricians, pediatric super specialists and associated specialists come to you with different talks with regards to children's health that we think that parents and families will find useful. We trust that you will have found these useful so far. You will continue to find these on Facebook and YouTube to access whenever you feel the need to, and to share with anyone who you think may find useful. We thank you for your support for the same, and it has helped us to bring back to you many more talks that we think that you will find useful. Today it is our honor to have with us Dr. Ramkumar. Dr. Ramkumar is an endocrinologist, that is a doctor who specializes in hormone disorders in both children and adults. Hormone disorders that many of you may be familiar with: thyroid problems, growth problems with growth hormone, obesity, diabetes. These are the diseases that Dr. Ramkumar specializes in. So today he is going to speak to us about diabetes in children. Many of you may be aware of diabetes in adults. In fact, many of you may have family members with diabetes. So it may come as a surprise or even a shock to you that children can have diabetes too. Diabetes in children is quite different from diabetes in adults. So Dr. Ramkumar is going to throw light on this. What causes diabetes in children? Can this be prevented? How is this treated? All these questions and more Dr. Ramkumar is here to answer. Welcome Dr. Ramkumar.
Thank you ma'am for the introduction. I will speak both in Tamil and English for all these questions.
Thank you so much Dr. Ramkumar for taking time off to answer these questions and be part of our Facebook Live. So starting off, we just passed November 14th, which was World Diabetes Day. Also in India it is Children's Day. So this is a good time to talk about diabetes in children. Dr. Ramkumar, can you give us an overview about diabetes in children?
Okay. We all know that the most common form of diabetes in adults is type 2, whereas in children it is not so. The most common form of diabetes in children is the insulin dependent type of diabetes, which we call it as type 1 diabetes. In addition to type 1 diabetes, there are also other forms of diabetes. So diabetes is a condition where there is the glucose is not converted into energy. We all know the insulin is the hormone which is produced from the endocrine gland, that is called pancreas, and when the hormone production is less, then it is called type 1 diabetes, or when the hormone is produced but it is not working well, it is called type 2 diabetes. So both these forms of diabetes can happen in children, although type 1 diabetes is the most common form of diabetes. Not only type 1 and type 2, but children do have other forms of diabetes. The third important thing is the genetic form of a diabetes. The genetic form of diabetes goes by the name MODY, M-O-D-Y, that is maturity onset diabetes of young. This happens in children who have family members, especially parent or a grandparent, with an onset of diabetes with much early, less than 25 years. The most important thing about MODY is that unlike type 1 diabetes, these children can be treated with tablets. So it is important that we make a correct diagnosis of the exact reason for diabetes at the beginning itself. Apart from type 1, type 2 and MODY, we do have other rare forms of diabetes. Like if there are any problems in the endocrine gland, pancreas, then the insulin production can go low and it can behave like a type 1 diabetes. Other than that, there are a lot of drugs which can cause diabetes. Common one is the steroid. Steroids can raise the blood sugar and cause diabetes. Commonly we see drug induced diabetes, especially in children who are undergoing renal transplant. After renal transplant, we use lot of drugs, immunosuppressive drugs and steroids, and that can cause diabetes, which we call it as NODAT, that is new onset diabetes after transplantation. Steroid induced diabetes can be completely reversed if we stop the offending drug, the steroid. Other than that, there are some endocrine disorders which can cause diabetes in adult, but they do occur in children, especially the Cushing syndrome, but these are all very uncommon disorders in children.
Thank you very much Dr. Ramkumar. It is very clear to understand the spectrum of what all causes diabetes in children. So let's start with type 1 diabetes. Type 1 or insulin dependent diabetes mellitus is a very common diabetes in children. So is it because children eat too many sweets? Is it preventable? And how do parents pick up if a child has got, what are the symptoms that they can pick up? Could you tell us something about this?
As I said earlier, type 1 diabetes is a condition where insulin production is low. We know that insulin is a hormone produced by the endocrine gland pancreas, and it converts the energy glucose, it converts the sugar glucose into energy. So, if insulin is not there, sugar remains as sugar in the blood and causes a lot of problems. This happens because of a condition called autoimmune disease. Normally our body produces certain antibodies, for example against COVID infection, our body produces antibodies to fight against these infections. But in autoimmune disease, body produces antibodies, but instead of fighting against some other foreign antigens, they fight against the body's own organ, for example in this case pancreas. So the insulin production, the cells which produce insulin gets affected, the insulin production goes low and develop diabetes. So it is not because the child eats lot of sugar the child develops diabetes, it is because of an autoimmune damage, and this happens at a much earlier age, especially in those children who have a genetic tendency to develop a type 1 diabetes.
Thank you very much, Dr. Ramkumar. So children with type 1 diabetes, what kind of symptoms will they exhibit? How do parents pick up if these children have got the symptoms? I mean, what are the symptoms that children will have?
Okay. So in type 1 diabetes, the sugar is not getting converted into energy, the sugar remains as sugar in the blood. So body will think that energy is insufficient, so body will try to stimulate more hunger, so they tend to eat more, what we call it like polyphagia, because lot of sugar is there, everything goes up through the urine, so it also takes away lot of water with it, so the children will have a tendency to pass lot of urine. They can have bedwetting, they can have to get up frequently during night to pass urine, and since they lose lot of water, they feel very hungry. They not only feel eating a lot, but also they feel drinking a lot of water. And other than that, in the other form of diabetes like type 2, they can even develop a genital infection, because lot of sugar is being passed through the urine, fungal infections can happen. And more important is the loss of weight. So whenever a child develops weight loss or not able to gain weight, this could be one of the early symptom of type 1 diabetes.
Thank you, Dr. Ramkumar. So now a child has been diagnosed to have type 1 diabetes. It's quite disturbing for the family. Whenever children have been diagnosed, usually the family is quite upset. Now one of the questions that is often asked is insulin the only treatment, and how long does it have to be taken for? So could you answer that question?
Yes ma'am, insulin is the only treatment available for type 1 diabetes. The way how we give insulin might be different, but insulin still remains the only treatment, and it has to be given lifelong. But all children or parents should remember that there is a condition in type 1 diabetes which happens in the initial few months called honeymoon phase. In this phase, the beta cells may start producing insulin, but this is a transient, it only lasts for a few months or few years, and during which the blood sugars may be under control even without insulin. So during the honeymoon phase, it is important that you continue the monitoring so that the child does not end up with DKA, diabetic ketoacidosis later. So as I said, insulin remains the only treatment on the long term treatment as on date for type 1 diabetes.
Thank you, Dr. Ramkumar. So it's important to know that insulin is a very important medication, and actually we are very lucky to have a medication that can treat type 1 diabetes so effectively. So many parents ask, many families ask, does insulin have any side effects?
Okay. So earlier, a couple of decades back, we used to use animal insulins, but now we have the recombinant human insulins, which are which have less side effects. The common side effects are the allergy to these insulins, but with newer analogs, the side effects are nil, but still sometimes they may develop an allergic reaction. Other than allergy, if you don't use the insulin properly, so normally we educate the parents and the child how to take the insulin, how to store it, or how to pinch the skin, and at what angle they should give, which location they have to give, how frequently they have to change the location, the site of insulin, how frequently they have to change the needles. So if these precautions are not followed, then skin may get damaged and they may develop a condition called lipohypertrophy. And the most important complication of insulin which everyone fears is the low blood sugar, hypoglycemia. So if this happens, then you have to treat them immediately with 3 teaspoons of sugar and then check the blood sugar in 15 minutes time. The reason for hypoglycemia could be because the child has taken insulin and not taken the food, or there is a long gap between insulin and food, or they have eaten less food, or they have taken more insulin. So we educate the children at the time of admission how to self monitor the blood sugar, so that we can avoid such a low blood sugar. So we can predict that low sugar is likely to happen, and we can avoid that. And we can also try to reduce the frequency of low blood sugar by adjusting the insulin based on the food intake, which we call it like carbohydrate counting. All these are all taught to our children at the time of discharge.
Yes, thank you, Dr. Ramkumar. So yes, it is this education of the child and the family is very important and very useful for the family to help them, and in fact a lot of them become quite expert at managing the diabetes by themselves. So one more question, a lot of families do ask, so would my child lead a normal life? Will my child get married? So what would you say for that?
So I would give the example of my experience of working in New Delhi AIIMS, All India Institute of Medical Sciences, where they have a separate diabetic of young clinic. But if you go to the clinic, you actually see children from 10 years of age till adults who are 60 years of age, who have been followed up for quite a long time. Almost they have 30-35 years of follow up. And what I see that those who have a good control of diabetes or free of complications, they are married and they have a children without diabetes. You know, type 1 diabetes is not inherited. So if you control the blood sugar very well, then you can be completely free of complications for at least 30-35 years or 40 years.
That's very good to know, and really good to know about that interesting follow up in AIIMS. So finally, Dr. Ramkumar, about type 1 diabetes, what are the complications that we can expect? What are the common complications of type 1?
The most important complication of type 1 diabetes is a condition called a DKA, diabetic ketoacidosis. So when insulin is not there, the sugar not only remains as sugar in the blood, but can also get converted into an acid, which is keto acid. And once lot of keto acids accumulate, the child can develop a fast breathing, they may become comatose, they may lose consciousness, they may even require an ICU admission, and if insulin is not treated well in advance and appropriately treated, they may even have mortality, death due to diabetic ketoacidosis. So it is important that every child should be taught how to prevent a DKA, that what we call it as sick day guideline. What happens in sick day guideline is when the main reason for DKA is that the child omits insulin and when they develop an infection. So it is important that you should not skip the insulin when you develop an infection. You should continue with the basal dose and keep regular blood sugar monitoring and add the short acting insulin also as per your blood sugars. And we also educate them about a urine ketone test, which you can do it at home. This is a keto sticks which is available in the pharmacy for around 300 rupees, which has around 50 strips. So each strip will be hardly around 5 to 10 rupees. So you collect the urine, dip it in the strip in the urine and just wait for 45 seconds and compare with the color code. If the color code changes, then it indicates your body is actually producing these keto acids. So this is a serious condition which may require a regular dose of insulin or sometimes even admission. So what we educate them is, whenever the ketones are positive and your child is sick, we ask them to give 10 to 20% of the dose extra. For example, if a child is taking a total dose of 40 units, 10% will be 4 units. So that you have to keep taking it every 1 hour or 2 hours according to the severity of your urine ketones until you meet the doctor. Suppose if you are coming from a far off place, if you follow this precaution, you may not end up with diabetic ketoacidosis. So this is taught, and we also give a handout for all these children how to manage if your child becomes sick.
Thank you very much, Dr. Ramkumar. So that gives us a good indication of how important insulin is to prevent these complications. And the last question in type 1 diabetes, wanted to know, a lot of research is going on about newer modalities of treatment, newer methods of monitoring children with type 1 diabetes. Could you tell us something about it?
Yeah, I would say the most important advancements are the different forms of insulin. So we have certain insulin which acts for 2 hours, which acts for 4 hours, which acts for 6 to 8 hours, 12 to 18 hours, 24 hours, and even now 42 hours. And all these insulin which are used in adults are now approved in children in various age groups. So we know which insulin should be given to which children based on their it's an individualized approach. So this so based on the different forms of available, we choose the insulin and decide how to better fine tune the blood sugar control in that particular child. Other advancement is the insulin pump. Now it's widely available. We have a lot of advancements in insulin pumps, and these insulin pumps deliver the insulin by a subcutaneous route. We inject the catheter into our body, and so we have to change once in 3 days. So when you take insulin, we have to take 3 or 4 shots per day, but when you use the insulin pump, just one prick every 3 days. So it's much flexible for the child and more convenient. The number of pricks are less. It's quite expensive, but the rate has also come down in the last few years. And more important is that we can combine the insulin pump with a continuous glucose monitor also. So, so the pump itself can sense whether the blood sugar is increasing or whether the blood sugar is decreasing, and pump itself can self adjust the basal rates by increasing the insulin or decreasing the insulin. So these are all newer modalities in the way we give insulin. Another important modality is the for monitoring is the continuous glucose monitoring. It's like a small coin, 1 rupee coin we attach in our body, anywhere the shoulder or anywhere in the body, and this can record the blood sugar as many as 300 times per day. So we don't have to prick multiple times, it can keep on recording, and there are currently we can even see the blood sugar in your phone. We don't have to use a sensor always, you can just take the phone and through Bluetooth it will be connected to your phone, and which can be shared with others also. And other than that, they have another device called Omnipod. It is not widely available in India, but I hope it will be shortly available throughout in all centers in India. This is a device which is attached with your body, and this can remain in place for a maximum of 3 days, and we can deliver insulin into that, so the number of pricks can be avoided.
That's very good to know, Dr. Ramkumar. So many more innovations, so children can look forward to less pricks of insulin per day and more advanced systems of administration and testing. That's very good to know. So moving on to type 2 diabetes. So could you tell us about a little bit more about type 2, which is very less common earlier on in children, and now I think we are seeing a lot more of it. So type 2 diabetes mellitus in children.
Okay. So whenever we say about diabetes, it commonly refers to type 2 diabetes in adult, but they say it's very uncommon in children, but it's actually becoming very common in children. You can all recollect when our parents developed diabetes, it would be around 50 years or 60 years. Grandparents would have developed even much later, but now we see a lot of young adults developing diabetes at 20 years or 30 years. And what we actually see in children and adolescents who are obese are that they tend to have a high blood sugars, high HbA1c, even at much younger age. As young as 9 years or 10 years, we have seen such blood sugars going high. So type 2 diabetes is becoming an emerging cause of diabetes in children and adolescents.
Thank you, Dr. Ramkumar. So you are telling us this is about, so could you tell us what is the reason for this rise in numbers of type 2 diabetes, and what exactly, what is the problem that happens in the body? Why do these children develop this type 2?
Okay. So type 2 diabetes, I said earlier, it could be because of a condition called decreased action of insulin. The hormone which is produced must convert sugar into energy. If the insulin hormone is not working, then body produces too much of insulin. We develop a condition called insulin resistance, but still the insulin does not work and the blood sugar keeps going up. The main reason for diabetes, that is type 2 in children, is the obesity pandemic. We all know what happened in the last 2 years. Lot of children stay indoors. There is a decreased physical activity, going out and playing. They watch lot of spend more time on TV and mobile, and they order food outside and eat. So they get a high calorie consumption and they develop obese, and these are the children who are at risk of developing diabetes, and not only diabetes, lot of other metabolic complications we actually see. When we say about metabolic complications, it is not only diabetes, high blood pressure, high cholesterol, high uric acid, high levels of insulin, even fatty liver. Even we see at least 30 to 50% of children with obesity developing some form of a fatty liver. and all these are called the metabolic complications of obesity. And this obesity not only causes diabetes in children, but very high risk of causing diabetes in adult at a much younger age.
Thank you, Dr. Ramkumar. So, tell us this type 1, type 2 diabetes. How is it treated? How is it prevented? Could you tell us something about it?
So, whenever an adult develops type 2 diabetes, the main thing which we focus on modification in the lifestyle and diet. Same applies for children also. As I said, it is because of the sedentary lifestyle, high calorie consumption, spending more time on electronic gadgets. So, all these things have to be avoided. They should cut down on the high calorie junk foods, fried items or oily foods outside. They spend less time. Nowadays, the American Academy of Pediatrics recommends only 2 hours or less of TV viewing or any time spent on electronic gadgets, and playing out, going and playing outside. Not and what I say them is you should eat in and play out. But what happens is actually the reverse. They play inside the house and they eat outside. So that tendency should be changed. And for example, they say India is a country where there is a lot of poverty, but we have not only undernutrition, but we also have a lot of overnutrition and causing obesity and type 2 diabetes in children.
Yes, thank you so much, Dr. Ramkumar. So, I think it also to emphasize that parents have a big role to play in how they guide their children through not developing better lifestyle habits. So, often we find families who tell us that the child is watching TV, the child is doing this. Actually, the role is for the parent to change a lot of that, isn't it?
Yes, ma'am. So, when we say about lifestyle modification, we can't just enforce the lifestyle modification on the children unless the parents change the amount of time they spend on TV, the amount of time they are ordering food outside, the way they eat food. If these things changed, then children follow their parents and they can copy the same in their lifestyle and hence prevent obesity and type 2 diabetes later.
Thank you very much, Dr. Ramkumar. So, if type 2 diabetes mellitus is not treated appropriately, what are the complications we can expect?
So, regarding type 1 and type 2 diabetes mellitus in children and complications in them, rarely we see complications in type 1 diabetes within 5 years of diagnosis, but in type 2 it is not same. We can see complications even at the time of diagnosis, and most of these complications are classified as small vessel complications or big vessel complications. When we say small vessel, that includes the eye, the retina, the kidney, the nerves. So they may have problems in the retina, the kidney they may start losing a lot of protein, and in the nerves they may have some burning sensation in the legs. There are 3 important large vessel diseases like what we call as macrovascular complications, which can involve the brain, the heart or the legs. These are all complications which happen especially if your sugars are not under control for a very long time. So, if your sugars are under very good control, you do not have to develop these complications.
Thank you, Dr. Ramkumar. So, the key is to get good sugar control. That is very good to know, because a lot of these can be prevented, the complications of diabetes, if sugar control is good. What is type 2 diabetes mellitus treated with?
So, like in adults, after the lifestyle modification, if the sugars are not under control, and after modifying the diet, if the sugars are not under control, we start them on a lot of medications for adults. Some of these medicines like metformin are approved in children, and we do use some of the drugs which are not approved. We still use it in children with good blood sugar control. One important drug is injection liraglutide. Unlike other drugs which can increase the body weight when we use them, this is a injection which can, this is not an insulin, but it can reduce the body weight and it can also reduce the blood sugar. This is approved in children, especially for children with obesity and type 2 diabetes. And if still the sugars are not under control, even with all these medications or with injection liraglutide, then we can still consider insulin for better sugar control.
Thank you very much, Dr. Ramkumar. So, you were talking, we finished type 1, we finished type 2. You were talking about another genetic forms of diabetes, something called MODY. Could you tell us something about that?
MODY is one of the third important causes of diabetes in children other than type 1 and type 2. MODY stands for MODY, maturity onset diabetes of young. This is a form of diabetes which happens, it's inherited from the parents. So, generally the family members do have diabetes, either one of the parent or in the grandparents, and the important thing is they develop diabetes at a much earlier age, less than 25 years. So, and another important thing about the treatment is, once we make a diagnosis of diabetes, we can treat them with tablets and not with insulin. So, what I remember in our previous institution, where when I started doing research on these children with type 1 diabetes, I started excluding MODI. Then I really found lot of these children are wrongly labeled as type 1 diabetes and have been on insulin, and some of these children we were able to change them to tablet or add a tablet and then reduce the dose of insulin with much better glycemic control.
Thank you very much. So, that really means that genetic testing has made a difference in so many children's lives. So, you do not, in some particular groups, that you can use medication tablets rather than injections and insulin. So, as a final word, Dr. Ramkumar, what would you say as a final conclusion?
Regarding type 1 diabetes, I would like to reiterate that insulin is the only option, only drug available as on date to treat type 1 diabetes. There are a lot of misconceptions or misinformation on social media that diabetes can be cured by other modalities, by alternate therapies, but as on date all these are all experimental only. I do agree there is a lot of research going on, but none of them has been approved to treat or cure type 1 diabetes. So, do not get misguided. Best option is insulin. There are a lot of different formulations of insulin or insulin pumps available to increase the compliance, and you also can feel much better and be flexible with these newer methods of insulin delivery devices. And regarding type 2 diabetes, you should worry about the obesity and the metabolic complications. You can easily prevent type 2 diabetes in children by having a good modification in lifestyle, diet, and restricting the time spent on these electronic gadgets. And I would like to emphasize that it is not just diabetes in children, but it is also prevention of diabetes as an adult. So, we are not only preventing diabetes in children, we are also preventing lot of complications of diabetes as an young adult or in the older age group.
Thank you very much, Dr. Ramkumar. Thank you. That was a very clear talk. I am sure our families have found this useful. Thank you very much.
Thank you, ma'am. Thank you for the opportunity to share my views on type 1 and type 2 diabetes in children. Thank you all.